Hello, can you hear? Okay, thank you. Very good morning to all of you. So today my lecture will be on the basic aspects related to cytogenetic analysis. I'm very sorry to inform you that I may not be able to talk the words in Bahasa Malay because I'm not familiar with Bahasa. You have to bear with me. Very sorry about it. So I will start my lecture by giving a scenario. A baby boy was born with a lot of dysmorphic features like cleft lip and palate, microphthalmia, that is small eyes, microcephaly, that is small head, low-seta and malformed ears, and polydactyly. And immediately the Parker pediatric ordered for cytogenetic analysis. Now I will show you the picture of that baby. There are a lot of abnormalities, including polydactyly, cleft lip and palate, and all the things like that. So immediately the doctor ordered for a cytogenetic analysis. Coming to another case, a Malay man, 53 years old. He had complaints of weight loss, low-grade fever, night sweats, anemia, splenomegaly, that is enlargement of the spleen. And then and he was seen at the clinic Pakar Pervatan, KPP. And the specialist doctor who was examining this patient also ordered for a cytogenetic workup. So what is this cytogenetic workup, or what is this cytogenetic analysis? You know that cytology is the term for the meaning for the study of cells. And genetics means study of heredity and its variation. Yesterday we have heard a lot about genetics, and you know that in human beings the genetic material is DNA, and the DNA is situated inside the nucleus. So cytogenetics is a combination of cytology and genetics. That means we have to study the genetic material at the cellular level. If it is at the cellular level, that means we have to study under the microscope. But we are not able to study DNA under the microscope. But we can study the genetic material when they become organized into structures known as chromosomes. Chromosomes we can study under the microscope. So that is the meaning for cytogenetic analysis. Cytogenetic analysis means study of the chromosomes. That means we study the genetic material under the microscope. It's a scientific study of the genetic material at the cellular level, preferably under the microscope. It's a subdivision of genetics that focuses on the structure and variation of chromosomes and cell division. So cytogenetic analysis is the examination of tissues or cells for the identification of constitutional chromosome abnormalities. Constitutional chromosome abnormalities means abnormalities that are present even from the time of birth itself. That was the first case, a baby born with a lot of abnormalities. That means we suspect that that baby may be having some sort of chromosome abnormality. And then the second one, cytogenetic analysis also involves examination of the chromosomes, that means acquired chromosome abnormalities. Acquired chromosome abnormality means abnormalities that are acquired during the later part of life. That usually we can see in the case of cancer cells. So constitutional chromosome abnormalities will be present even from the time of birth itself, whereas acquired chromosome abnormalities will be present only in the malignant cells. So if a person has a cancer, the cancer cells will be showing chromosome abnormalities in the cancer cells only, whereas all his other cells will be showing normal chromosomes. So the purpose of chromosome abnormality is chromosome study or cytogenetic analysis is to study the numerical and structural characteristics of chromosomes and to identify and report the abnormalities present, if any. Now let us see what are chromosomes. Yesterday there has been a lot of lectures regarding the chromosomes. So now you know about what are chromosomes. They are carriers of the genetic material which are microscopically visible as rod-like structures during the time of cell division. That is very, very important. If you want to study chromosomes, the most important thing is that the cell should be dividing. Then only you will be able to visualize the chromosomes. If the cell is not dividing, you may not be able to visualize chromosomes. So if you want to do cytogenetic analysis or chromosome analysis, the most important thing is that you should get dividing cells. That is very, very important. So chromosomes are the vehicles by the units of genetic information, or genes are transmitted from cell to cell and also from generation to generation. And chromosomes are the material basis of heredity, and their information is stored in the DNA molecule which forms the backbone of the chromosomes. So the chromosomes contain DNA as well as proteins. That is the structure of the chromosomes. A segment of DNA that contains biological information and which codes for an RNA or a polypeptide molecule is called a gene. That means the genes are located inside the chromosomes. That means in the chromosome you know that DNA is there. So genes are part of the DNA. And genes occupy definite sites in particular chromosomes and are arranged in a linear order. And all the characteristics which an offspring inherits from its parents are transmitted through the genes located at specific sites on chromosomes. According to the latest reports from the Human Genome Project, human beings contain around 26,000 to 30,000 genes. And the maximum number of genes are located in the chromosome number 1, that is 2,968 genes. Because chromosome number 1 is the largest chromosome in the human being, and the lowest number of genes are located on the Y chromosome, that is 231 genes. And if you extract the DNA from a single cell and measure it, you can see that it will be almost 2 meters, that is 200 centimeter of DNA in one cell. So you can imagine the length. If you extract all the DNA from a single human being and combine it, you can imagine how much will be the length, the whole DNA in a human being. Because in human beings there will be trillions of cells. So extract all the DNA and you add up, it will be, we can't imagine what will be the length like that. In some other books they say that it will be almost the distance from going from Earth to the moon or something like that. So it will be that much length. So anyhow, don't worry about all these things. This 200 centimeter or 2 meter of DNA, it has to be organized into chromosomes when the cells start to divide. So for that, the DNA will be spirally coiled and packaged with the proteins. That is what is happening during just before the start of the cell division. So these are the 5 levels of packaging and folding, and this is how it happens. The DNA will be like this initially, and they get packed with proteins. Then again further will be coiled. Then they become loops, rosettes, and finally they become organized into structures known as chromosomes. So during the interphase stage, that is the early phase of the cell division, we may not be able to visualize chromosome, but as they enter into the mitotic phase, we can see like chromosomes like this. So this is how the DNA gets organized into chromosomes. Here also it is shown, the DNA, they get coiled with the proteins and finally they become organized into chromosomes. This is an electron-microscopic picture of the chromosomes. So the morphology of the chromosome is most clearly visible during the metaphase stage. That is also another important thing. Because if you want to do chromosome analysis, we should get dividing cells, not only dividing cells, but we should get dividing cells in the metaphase stage. I think most of you know there are different stages in the division, that is prophase, metaphase, anaphase, and the cytokinesis, final telophase and cytokinesis. And for a cytogenetic analysis, the most important stage is metaphase, because the morphology of the chromosome will be most clearly visible during metaphase stage. So we should get cells in the metaphase stage if you want to do chromosome analysis. For that, what we have to do is, when we have to culture the cells, and then we have to add a chemical known as, that I will explain later, the reagents used for chromosome analysis. So all the normal cells in the human body will be containing 46 chromosomes, out of which 22 are autosomes, and then there will autosomes. So 22 means 22 pairs. That means 44 chromosomes are autosomes, and there will be 2 sex chromosomes, XX in females and XY in male. Whereas the sex cells, that is the sperm and the ovum, they will be containing haploid. That means half, only half. Only 23 chromosomes will be present in the sperm and the ovum. So at the time of fertilization, this sperm and the ovum will unite, and then the 46 is restored, and that is how the zygote is formed. Now let us see how we do the cytogenetic analysis. These are some of the basic steps involved. I already told you that we should get dividing cells. If you want to do chromosome analysis, we should get dividing cells. That is the most important thing. And then we had to culture these cells in vitro condition so that we get a large number of dividing cells. Then previously I told you that the morphology of the chromosomes are most clearly visible in metaphase stage. So we should get cells which are in the metaphase stage. For that, we had to arrest the dividing cells in the metaphase stage by adding a chemical known as called cimate. That is a chemical which arrests the dividing cells in the metaphase stage. So all the dividing cells will be blocked in the metaphase stage, and we'll be getting a lot of cells in the metaphase. So we can study the chromosome morphology very clearly. Then another is hypotonic treatment. We give some sort of a treatment with 0.075 molar potassium chloride. That helps, the cells will swell because of this treatment, and that help in better spreading of the chromosomes. You know that the chromosomes are inside the nucleus are very, very in a compact form because all are very, very small. The nucleus, inside the nucleus, it will be very crowded. So once we give this hypotonic treatment, the cells will swell, and that helps in better spreading of the chromosomes. Then we have to fix the cells with a fixative, that is methanol and acetic acid in 3:1 ratio. Then after that, we have to prepare the slides. That is also very, very critical. We should have the technologists who is doing this should have very good skill, because we have to hold the slide from in one hand and then take the cell suspension in another hand and drop from a distance. And because of this fall from this height, the cell wall will break and the chromosome will adhere to the slide. That is very, very critical. If the height is too high, the chromosomes will be overspreaded. If the height is too short, the chromosome will be underspreaded. So that will affect in counting the chromosome number and like that. Then after this, preparing the slides, we have to dry it and then do the staining. Then after that, we have to observe under the microscope, and then we have to pair the chromosomes individually like that. Earlier days, it was very difficult to do these sort of things because everything has to be done under manual. We had to take photograph of the metaphase and then cut with scissors and then arrange them in pairs like that. But nowadays, we have softwares attached with the microscope, so we can do the karyotyping with the help of a software. So let us see what are the types of tissues used for chromosome analysis. That depends on the type of patient, whether it is prenatal or postnatal condition, and also depends on the clinical indication. If we want to do prenatal condition, that means if we want to do the chromosome analysis of the fetus, we have to get fetal cells. That we can get by some techniques known as amniocentesis or chorionic villi sampling, and then we have to do the culture of those cells and do the chromosome analysis. Then if we see that the fetus is having some sort of abnormality, chromosome abnormality, we can advise medical termination of the pregnancy and avoid the birth of a child with a chromosome disorder. So these are the samples taken for prenatal chromosome analysis. There is amniotic fluid, chorionic villi, and sometimes fetal blood lymphocytes also can be extracted using choriocentesis technique. Then sometimes we have to study the aborted fetuses also, because most of the aborted fetuses will be having some sort of chromosome abnormality. So we want to, if we want to see whether the abortion is due to the chromosome abnormality, we can do chromosome analysis using the tissues of from the aborted fetus, like skin, lung, kidney, etc. of the aborted fetus. So this is the procedure for amniocentesis. It's a procedure by which a sample of amniotic fluid and its cells is obtained from the pregnant uterus at the 14th to 16th week of pregnancy. So once we get this amniotic fluid, there will be fetal cells in that fluid. We had to isolate the cells and then culture and then do the chromosome analysis. So this is a procedure for amniocentesis, and this should be done under the guidance of ultrasound scanning because the risk is involved. Another technique for prenatal diagnosis is chorionic village sampling, which involves removal of a small sample of chorionic tissue, usually by aspiration biopsy with a thin plastic catheter inserted transvaginally or transcervically into the interior of a pregnant uterus. And then we get chorionic tissue. That also we can culture and do the chromosome analysis. This is the procedure for chorionic village sampling. This also should be done under ultrasound scanner. Now coming to the adult, neonatal and adult condition, that is after the birth. So the tissues commonly used will be peripheral blood and bone marrow. But as far as human beings are concerned, we prefer to take bone marrow. That will be the prime tissue of choice. Any reason? Why bone marrow will be the prime tissue of choice for chromosome analysis? Because bone marrow contains rapidly dividing cells. So we can directly process for chromosome analysis using if it is bone marrow. But the problem is bone marrow is an invasive procedure. So most of the time the patients who want to do chromosome analysis, they will be small kids. So the parents may not be willing to do bone marrow procedure. It is a painful and invasive procedure. So in such cases what we do is we take peripheral blood. The sampling will be easy if we do peripheral blood. But there is some problem with the peripheral blood. In peripheral blood, there may not be any dividing cells. All will be mature cells. So in such case, we had to induce division by adding a chemical known as phytohemagglutinine. Then only the cells will be dividing. So that is the difficulty with regard to peripheral blood. And then in the case of cancer cells, it depends upon the type of cancer. If it is leukemia, we have to take the bone marrow. If it is lymphoma, another type of cancer affecting the lymph gland, we have to take the lymph gland. And then if it is solid tumors like breast cancer, oral cancer, cervical cancer, etc., we have to collect the affected tissues and then do the chromosome analysis. And sometimes we have to take samples from the spinal fluid, pleural fluid and ascitic fluid of a cancer patient to see whether cancer has spread to those sites. Because the cells from those sites will be showing chromosome abnormalities. That indicates cancer has spread to those sites. So depending upon the technique employed, there will be immediate technique, short-term technique, and then long-term. For bone marrow, even though there will be dividing cells, we generally perform a short-term culture. The purpose of short-term culture is to increase the yield of metaphases, so that we will get a lot of metaphases. And then in the case of other tissues like peripheral blood, skin fibroblasts, amniocytes, chorion, we need long-term culture, more than 3-4 days like that. For peripheral blood, the number of days are 3 days, that is 72 hours of culture. So these are the primary elements involved in tissue culture, no need to go to the details. The most important thing is that since we are doing it in vitro condition, everything should be done under sterile conditions, and there should be a very good sterile tissue culture room. Everything, the tissue culture media, all the components related to the culture should be sterile. Otherwise, the tissue will be contaminated and we may not be able to get results. So these are the reagents used for chromosome study, that is tissue culture medium. Tissue culture medium means solutions of glucose, electrolytes and other amino acids, and they provide the environmental conditions for the growth of the cells. Various types of tissue culture media are available like TC19 and RPMI 160. We generally use RPMI 1640. Then we add to the tissue culture media, we add fetal calf serum as an additional source of protein. And in order to prevent the infection of cultures, we add antibiotics, that is penicillin and streptomycin. Then the metaphases are arrested using colchicine or colchicine. Then all the hypotonic treatment, fixation, everything I have already told you. Then the mitogen. I told you if you want to do chromosome analysis using peripheral blood, the most important thing is don't forget to add mitogen. That is, mitogen means an agent which induces division. That is, a phytohemagglutinine is the mitogen that is used if we are using peripheral blood. So depending upon the type of tissue, we use bone marrow culture, peripheral blood lymphocyte culture, or amniotic or chorionic villi culture, skin fibroblast cluster, and malignant tissue culture. And this is the diagram showing the peripheral blood lymphocyte culture. We take the blood of the patient and then culture. Then we had to culture for 3 days and then make the slides and observe under the microscope. Then we can see chromosomes like this. So after that, seeing the chromosome, then we had to start analyzing the chromosome abnormalities. For that, we had to pair the chromosomes according to the length, position of centromere, and then specific banding pattern. For that, human karyotype is divided into 7 groups: A, B, C, D, E, F, G. Group A consists of chromosomes number 1 to 3, B 4 and 5 pairs. Group C, chromosome number 6 to 12. Group D 13, 14, 15. Group E 16, 17, 18. Group F 19, 20. Then group G 21, 22. And then the sex chromosomes are arranged separately. So this systematic arrangement of the chromosomes from a cell in groups of homologous pairs according to their length, position of centromere, and specific banding pattern is known as karyotyping. This process is known as karyotyping. So this is how a metaphase will look under the microscope. You can easily count the number of chromosomes by looking under the microscope. Then after that, we have to arrange like this. This we have to do using software attached to the microscope. So these are the pairs, chromosome number 1, pairs of chromosome number 1. One is the pair, one of the pair will be derived from the father and the other will be from the mother. So all the chromosomes will be represent, all the autosomes, that means chromosome number 1 to 22, they will be homologous pairs, one derived from the father and one from the mother. And the sex chromosome will be not homologous because they are not having the same genetic constitution. So this is another metaphase. When you count this, you can see that there are 47 chromosomes. So that means there is one extra chromosome. So in order to find which is the extra chromosome, we have to do karyotype analysis. And then on karyotype analysis, we can see that there are 3 copies of chromosome number 21. That means the extra chromosome is chromosome number 21. But still, this procedure is not correct because you can see the chromosome number 22 that also resembles exactly like 21. So we may not be very sure whether it is the extra chromosome is 21 or 22. So in order to confirm that, we had to do another technique known as banding. So once we prepare the slides, we had to do banding, GTG banding, and then stain the chromosomes. Then only we can correctly identify the homologous pairs. This is a banded preparation. You can see that there are dark and light areas along the length of the chromosome that we call as dark bands and light bands. So each of the homologous pairs of chromosome have specific banding pattern. For example, chromosome 1 has one pattern, chromosome 2 has another pattern like that. So all the homologous pairs of chromosomes have specific banding pattern by which we can identify the homologous pairs correctly. Now you can see this. This is from a metaphase showing 47 chromosomes. Here you can see that there are 3 copies of chromosome number 21. All the 3 copies are showing same banding pattern. So that confirms that the extra chromosome is chromosome number 21. So this is the karyotype from a Down syndrome child. Because Down syndrome children have one extra chromosome which is chromosome number 21. So what is the purpose of chromosome analysis? Why is it needed? Can changes in the number or structure of chromosomes affect health and development? For that we had to know something about the chromosome abnormalities that usually come in the human beings. That again we can divide it into 2 groups. That is numerical chromosome abnormality, that meaning that there will be abnormalities in the number of the chromosome, either an increase in the number of chromosome or a decrease in the number of chromosome. And then structural abnormality, that means there will be abnormality in the structure of the chromosome, like translocation, exchange of segment between 2 chromosomes, deletion, as a portion of a chromosome will be deleted, then inversion, a particular segment of a chromosome will be inverted, then duplication, exactly like the term denotes, the meaning is like that. Isochromosome, all these are the abnormalities that we look for in a karyotype. So all the human somatic cells contain pairs of chromosome maternally and paternally derived. They are homologous pairs. That is, pairs 1 to 22 are the homologous pairs, and we call them as autosomes. And then human cells also contain sex chromosome, that is X chromosome, which are maternal and paternal. And then Y chromosome, it's only derived from the father, that is paternal. So X and Y chromosomes are non-homologous chromosome. So normal human development requires 2 copies of the most genes present in the homologous pairs of chromosome. So changes in the number or structure of the chromosome can result in change in the copy number or expression of genes. That means if there is an extra chromosome, that means the number of genes also will be extra in that chromosome. If 2 copies are not present, or if more than 2 copies are present, there will be gene dosage problem. That means there will be the dosage of the genes will be either increased or decreased based on the presence or absence of the chromosome. So a change in the number or structure of chromosome can cause problem with the growth, development and function of the body systems. So change in the structure and number of structure are detected at the microscopic level by cytogenetic technique. So all the types of chromosome abnormalities, like the number of the chromosome or the structure of the chromosome, we can detect by cytogenetic analysis. That is the purpose of cytogenetic analysis. Sometimes there will be changes at the gene level that we cannot detect under the microscope. For that we have to do molecular techniques. Dr. Tego will be explaining about the molecular technique in the next lecture. Now coming to the chromosome abnormalities that we commonly see in the human population. I have already told you that there will be 2 types of chromosome abnormality, that is constitutional chromosome abnormality and then acquired chromosome abnormality. Again, constitutional chromosome abnormality can be divided into autosomal chromosome abnormality and sex chromosome abnormality. Autosomal means any abnormality related to the chromosome 1 to 22. They are all autosomes. Whereas chromosome abnormality related to sex chromosome, it's called sex chromosome abnormality. I think the time is short, I have to skip. So these are the most commonly occurring autosomal disorder, that is trisomy 21, known as the Down syndrome. Then trisomy 18, there are 3 copies of chromosome number 18, known as Edwards syndrome. Then trisomy 13, known as Batau syndrome. Then there are several other syndromes associated with this structural abnormality of the chromosome. These are the chromosome abnormalities associated with the sex chromosome. Like what yesterday it has been shown, like Klinefelter syndrome, then XYY, XX males. Then among the females, the most common is Turner syndrome. That means females having only 1 X chromosome. Then mosaic Turner, then XY females. Yesterday Dr. Nasia has already shown about these sex chromosome abnormalities. So these chromosome abnormalities cause many chromosomal syndromes. Fetal wastage, that means there will be spontaneous abortion. Then some of the children will be having mental retardation. Then some of the couples will be having infertility. That means even after getting married for 4 or 5 years, they may not be able to produce children. That means infertility. So the cause may be some chromosome abnormality in one of the partner. Then repeated spontaneous abortion. The cause can be chromosome abnormality. Then primary amenorrhea. Primary amenorrhea means absence of menstruation even after attaining the age of 18 years. The cause can be chromosome abnormality, that is Turner syndrome. Turner females who have only 1 X chromosome, so that will result in primary amenorrhea. Then abnormal sexual development, that is development of ambiguous genitalia or other sex chromosome disorders. So cytogenetic analysis helps in accurate diagnosis of the suspected known syndromes and also in finding an underlying genetic defect which may have a causative role in many other clinically abnormal conditions. So these are the importance of chromosome studies in neonatal and adult conditions, that is to confirm or rule out classical chromosome syndromes, to identify the cytogenetic cause, if any, associated with the children with the multiple congenital abnormalities, mental retardation, growth failure, then in couples with infertility problems, recurrent abortions, to confirm the genetic sex of children with ambiguous genitalia or abnormal sexual development, to investigate the carrier status of parents of siblings with chromosome abnormality, to confirm the chromosome instability syndrome, and then to identify leukemia specific subtype specific chromosome abnormality. That is a very important aspect. A lot of chromosome abnormalities I told you are associated with in the cancer cells, and some of the abnormalities are specific for a specific type of cancer. So in order to identify this, we have to do chromosome analysis. I will show one example. This is the second slide I mentioned about one Malay person having doubted to have chromosome and like leukemia. In such cases, what we have to do is we have to do the chromosome analysis using the bone marrow. And if we see that there is a minute chromosome like this, we can say that it is a diagnostic marker for a particular type of leukemia known as chronic myeloid leukemia. This is normal chromosome 22, but you can see that the pair is very short. That is known as the Philadelphia chromosome, which is associated with the leukemia known as chronic myeloid leukemia. This is the Professor Janet Rowley who discovered showed that this Philadelphia chromosome happens as a result of translocation between chromosome number 9 and 22. So you can see that this is another Philadelphia chromosome. The portion from here has been translocated to chromosome number 9. There are a lot of applications for cytogenetic in the field of cancer. I don't have much time for describing all the things. It also helps in classifying other types of leukemia, especially in acute myeloid leukemia. This is a translocation between 8 and then 21. This is normal 21, this is abnormal 21. This much portion has been translocated to here. So cytogenetic analysis helps in the diagnostic, classification and prognostic assessment of other types of cancers like acute lymphoblastic leukemia, multiple myeloma, and also sarcomas, which are cancers of the connective tissue such as muscle, bones and like that. So we can make a genetic classification for sarcomas also. Then sometimes it will be difficult to identify the chromosome abnormality under the microscope, especially for the cancer cell. So we had to resort to new molecular techniques like FISH. These are some of the pictures showing FISH. But this is very expensive. The FISH technique is very expensive. But there are certain advantages with regard to using FISH. Then still there are other cytogenetic techniques like comparative genomic hybridization and array comparative genomic hybridization, by which we can identify some still very minute abnormalities which may not be identifiable by under the microscope. So in such cases we can use these molecular techniques, molecular cytogenetic techniques. Our cytogenetic laboratory, we have a cytogenetic laboratory in the Human Genome Center, and it is a nationally accredited as well as internationally accredited, and we process almost 350 blood samples in a year and as well as 250 bone marrow samples per year. So these are the various types of patient samples that we receive, and these are the various types of cancer types that we do for chromosome analysis. And these are the molecular cytogenetic techniques used for using FISH technique. We have specific probes for all these hematological malignancy associated gene fusions. So cytogenetic analysis helps in the identification of constitutional chromosome abnormalities, if any, which may be the underlying reason for a genetic disorder or a medical problem, and thus help to make an accurate diagnosis and provide genetic counseling. And also cytogenetic analysis helps in the identification of acquired chromosome abnormalities in various types of cancers, because some of the abnormalities may be associated with a specific type of cancer. So that helps in the accurate diagnosis, treatment, response monitoring, and also prognosis prediction. Thank you.